For the first time in Colorado, a man has been sentenced to life in prison after he was convicted of distributing fentanyl, resulting in death. 90's reporter Darius Johnson joins us from outside federal court this morning. And Darius, this is significant because he is the first Colorado man to be federally convicted on these charges.
Hey there, good morning to you both. I can tell you that Bruce Holder is the first person to be convicted and charged with fentanyl distribution resulting in death in the state of Colorado. Inside a federal court yesterday, Holder was sentenced to life in prison without the possibility of parole. And the prosecutors inside say he's responsible for the deaths of at least 9 people after years of dealing counterfeit pills that were laced with fentanyl. Holder, for years, was dealing pills back and forth, thousands of pills, from Mexico, bringing them to the state of Colorado in Ziploc bags. He was charged in the December 2017 death of Jonathan Ellington in Carbondale, though prosecutors determined he's responsible for at least 8 other deaths between 2017 and 2018. That includes the death of 32-year-old Ashley Romero of Grand Junction. She died in June of 2018 after taking half of an oxy that she didn't know was laced with fentanyl. Her mother says it feels good to know the system finally worked.
I feel like this moment really speaks for the hundreds of thousands of parents out there that have never had the opportunity to have their child's death investigated. Today shows that there still is value for human life.
Working with Andrea now for almost a year, it's so hard to hear her emotion, but also just so good to see that she's been able to make it to that day, along with so many other families as well. I can tell you that Bruce Holder was previously housed in Nevada during that time. However, since his sentencing, it's unclear at this point in time where he will be serving that sentence. However, he does have the right to an appeal, Corey.
Yeah, I'm sure this feels like a step in the right direction for a lot of these families, but still not enough for them.
Definitely a step in the right direction, I think, especially after you see some of the new laws that have been put in place to really put out stricter penalties for those who are dealing and distributing fentanyl. But again, for these families, as you just said, this doesn't bring back their loved ones. Ashley's 13-year-old son was standing right there next to Andrea yesterday when all of that happened.
Oh, and your heart just breaks for these families. Yeah. All right, Darius, thank you. Across Colorado, there were more than 900 fentanyl-related deaths in 2021. That is twice the amount as the year before.
The drug has the full attention of doctors, law enforcement, and lawmakers. Our News Roy looks at what widespread awareness can and can't do to fight against fentanyl.
Fentanyl is a lethal opioid contaminating drugs.
From PSAs across social media to district attorneys trying to reach families.
I try to talk about it in almost every public appearance I have.
And emergency rooms rolling out programs, handing out naloxone.
I am seeing a difference, and I think the education is crucial.
There is an across-the-board effort to make fentanyl a part of everyday conversations. Based off the metrics, the Keep the Party Safe campaign through the Drug Consortium was successful at getting people's attention on TV and social media. Dr. Katie Sprinkle with the Medical Center of Aurora ER said the number of patients have not gone down, but she has seen more people interested in getting treatment.
Similarly for Narcan, just more people know what it is and how to use it, and there seems to be less stigma around its use.
And Dr. Rob Valek with the Drug Consortium believes that people are starting to get more real about the situation.
More people think it applies to them than they did 6 months ago.
But for all those steps forward, everyone today said they are up against a powerful enemy. And it haunts 17th Judicial District Attorney Brian Mason.
And the most egregious and horrific example of that is the 5 deaths in Commerce City.
5 people, Mason said, thought were taking cocaine, not fentanyl.
I was out on scene that night, and the tragedy and shock of that crime and that incident stays with me to my core.
A case Mason said has essentially gone cold.
And we just haven't been able to put together a case that has the evidence to support it.
Despite all the conversations and outreach, he still meets people who don't even know what fentanyl is.
Or who have heard vaguely about it but haven't talked to their kids about it.
A fentanyl overdose.
Which is why across the board, experts said doubling down on messaging for kids and parents is key. So is a bigger push for more naloxone and access to treatment.
And I don't think we'll ever get ahead of it until we really focus on early childhood through young adulthood and detection and better behavioral health in general.
Anusha Roy reporting there. We don't have the number of fentanyl deaths for 2022 yet, but Dr. Valek says Colorado could be reaching a plateau. He says that's not great since numbers are still high, but he also says that's better than deaths continuing to go up.
Another library in Colorado is closing temporarily because of meth contamination. The drug was found in bathrooms and other areas of the Inglewood Public Library. City leaders say they decided to test surfaces there after Boulder's main library had to close because of meth contamination. Boulder's library is back open now, but now the restrooms at RTD's downtown Boulder station are closed. They tested and also found meth exceeding CDC limits in the bathrooms and the hallway outside.
The Biden administration is renewing the COVID-19 public health emergency provision. This allows the federal government to continue tracking data and lets pharmacists keep giving vaccinations in addition to doctors. The administration was expected to extend the provision. They've said that they'd give a 60-day notice before ending it. COVID cases nationwide are up. Only about 15% of Americans eligible for an updated booster have gotten it.
Here in Colorado, we are above the national average. 25% of eligible Coloradans have gotten their updated booster. Now, cases are still high, but they are slightly dropping. Our 7-day positivity rate is sitting around 8%. Right now, 245 Coloradans are in the hospital with the virus.
A new report from the Colorado Hospital Association says hospitals across the state are struggling to get by. The report says hospitals are facing serious financial issues with no relief in sight. It also found more than half of Colorado's hospitals are unable to make ends meet. Many are operating in negative margins and don't have a lot of reserves or savings. Plus, so many things have gotten more expensive since the pandemic started, from equipment to staff.
I think when it's hard to adequately prepare for the future when you're only focused on today, right? And these economic conditions are really requiring hospitals to focus on the short term.
The report says the financial situation is made worse by federal and local COVID funding drying up, and all this means struggling hospitals could put a strain on local tax resources.